Insufficiency and inadequacy of B12 are rather prevalent even though the vitamin is present in a great number of meals. The symptoms of a B12 deficiency can range from physical to psychological. Vitamin B12 is an essential component that is required by your body for processes, such as the synthesis of DNA, the creation of energy, and the function of the central nervous system. According to some studies, up to 20% of adults over the age of 60 in both the United States and the United Kingdom may be suffering from a vitamin deficiency. This is frequently the result of restricted food intake, malabsorption, certain medical disorders, or the consumption of drugs that deplete vitamin B12. The ability to absorb B12 from diet decreases with age, which is one of the reasons why B12 deficiency is more prevalent in older persons. Despite this, it is still possible for children and younger adults, including women who are pregnant or nursing, to have a B12 shortage. The diagnosis of a B12 shortage is sometimes incorrect, frequently as a result of insufficient laboratory testing or as a result of symptoms that are not particularly distinct. What then takes place when your vitamin B12 levels are low? Keep watching the video to learn about 9 of the symptoms that are most frequently associated with a B12 deficiency, as well as how this deficit can be identified and treated. But before we move further, subscribe to this channel for more informative videos like this one. Number 9. Fatigue. Fatigue is a common symptom of low levels of B12 in the body or a B12 deficiency. To carry out their intended functions, the cells in your body require B12. As a result, having insufficient levels of B12 can lead to a reduction in normal red blood cell synthesis, which in turn can cause problems with oxygen transport. Megaloblastic anemia is one of the potential complications that might arise from a B12 shortage. This disorder causes the development of red blood cells that are abnormally big and immature, as well as a disruption in the process of DNA synthesis. Number 8. Skin that is white or yellow. Similar to the disease known as iron deficiency anemia, anemia caused by a lack of B12 can cause your skin to become pale, because your body does not have enough completely developed and healthy red blood cells. A lack of vitamin B12 can also lead to a condition known as jaundice, which is characterized by a yellowing of the skin and the whites of the eyes. Jaundice is caused by an increase in bilirubin levels in the body. Number 7. Headaches and migraines. Both adults and children who are lacking in B12 often complain of experiencing headaches as one of the side effects of this condition. In a study that involved 140 persons in 2019, it was discovered that the participants who suffered from migraines had considerably lower amounts of B12 in their blood than the other participants. In comparison to the people who had the lowest B12 levels, those who had the highest levels of B12 had an 80% lower risk of experiencing migraines. Ongoing research aims to determine whether or not treatment with B12 can alleviate the migraine headache symptoms experienced by some individuals. Number 6. Signs and symptoms of depression. A lower level of B12 in the body is linked to an increased likelihood of getting depression. Insufficient amounts of vitamin B12 have been linked to increased concentrations of homocysteine, an amino acid that contains sulfur, by increasing oxidative stress, DNA damage, and cell death in the body. This may, in turn, contribute to the development of depression. The individuals with depression have lower levels of B12 and greater levels of homocysteine in comparison to those who do not have depression. Low or insufficient amounts of vitamin B12 have been linked to a variety of mental health issues, including psychosis and mood disorders, in addition to the symptoms of depression. Number 5. Problems with the gastrointestinal tract. Inadequate levels of vitamin B12 have been linked to a variety of gastrointestinal issues, including diarrhea, nausea, constipation, bloating, gas, and others. These problems can affect people of any age, including youngsters. Number 4. Difficulty concentrating and a general decline in mental capacity. People who are deficient in B12 or have low amounts of it may experience mental fogginess, have trouble concentrating, and find it difficult to complete tasks. This is because B12 deficiency has a detrimental impact on the central nervous system. Numerous studies have found an association between low B12 levels and a decline in mental function in people of advanced age. The good news is that treatment with B12 has been shown in tests to alleviate mental impairment caused by insufficient levels of B12. For instance, a study conducted in 2020 administered B12 replacement medication to 202 participants who had minor mental impairment, low or subnormal B12 levels, and increased homocysteine levels over 3 months. Following completion of the treatment, 84% of the patients reported significant improvements in their symptoms, which included an increase in forgetfulness as well as a loss in their ability to focus. Number 3. Discomfort in the oral cavity and irritation of the tongue. A tongue that is inflamed, reddened, and painful is referred to as having glossitis in the medical field. A lack of vitamin B12 in the body may be to blame. Glossitis is a condition that can occur alongside stomatitis, which is characterized by ulcers and inflammation in the mouth. In those who are affected by this deficit, glossitis and stomatitis are common in persons who have anemia that is caused by a B12 deficiency. However, glossitis and stomatitis can occur even in the absence of anemia and may be an indication of an early B12 insufficiency. However, glossitis can also be brought on by a variety of other factors. Number 2. Tingling or numbness in the hands and feet. Many people, including children and adults, who are deficient in B12 report having paresthesia, which is described as a prickling or burning feeling in some parts of the body, including the hands and feet. Unfortunately, this symptom of B12 deficiency overlaps with symptoms related to diabetic neuropathy, which is nerve damage caused by high blood sugar. Diabetic neuropathy can cause pain and numbness in the extremities. Metformin can decrease the amount of vitamin B12 that is absorbed by the body, which puts diabetics who take the drug at an increased risk of developing B12 deficiency. Therefore, patients who have diabetes may receive an incorrect diagnosis of peripheral neuropathy if they have a B12 deficit. As a consequence of this, many medical professionals advise that persons who take metformin daily get checked for vitamin B12 insufficiency. Number 1. The blunt disorder anemia. Anemia caused by a lack of vitamin B12 occurs when your body does not produce enough healthy red blood cells as a result of a lack of vitamin B12. This causes your body to become anemic. Vitamin B12 is essential for the production of red blood cells. Anemia is one of the potential side effects of not getting enough vitamin B12. Someone can be deficient in vitamin B12 but not have anemia at the same time. Even though it's not very frequent, a shortage in vitamin B12 or folate, with or without anemia, might result in difficulties. This is especially true if the deficiency in vitamin B12 or folate has been present for a considerable amount of time. Here are examples of difficulties that could arise. Difficulties with the nervous system, only temporary infertility, disorders of the heart, problems during pregnancy and abnormalities in the newborn. Adults who suffer from severe anemia have an increased likelihood of getting heart failure. Some difficulties get better with the appropriate therapy, but others, such as issues with the neurological system, can be ongoing for the rest of the patient's life. Vitamin B12 deficiency can be difficult to identify since its symptoms are not always present, and even when they are, they can be similar to the symptoms of other nutritional deficiencies. When treating patients who have a high risk of acquiring vitamin B12 insufficiency, medical professionals will typically conduct routine blood tests to check for the presence of vitamin B12 deficiency. So this is the end of our today's video. Do you like it? Kindly share your valuable response in our comment section below, and don't forget to subscribe to Wellness Wisdom for more interesting and informative videos.